Okay, so at this time, we're going to go into executive session. Do I have a motion?
I'll make a motion.
Do I have a second? Second?
Morris Rebello makes a second.
Morris, okay. All those in favor say aye.
Aye.
All right.
And for the record, the reason for executive session is matters relating to the employment of a particular person or person.
In favor, say aye.
Aye.
Aye. Aye. Motion passes. So I think we have two resolutions. And I know you got to go here. You
We can
wanna-
do them quick. I'll stay a minute. Another
All
minute.
right, we're going to do them really quick here. Doc, you want to do your your resolutions right away, and then Ralph Hitt needs to leave.
Except that the Healthy Family Grant Fund is also quite related. And because state, I think last time I talked about family program and state gave us fully funded for 5 years. Then state pull back, and because state at the state level funding cut, and they pull back their state some of state funding and come with original some funding. And anyway, for the county, yes, I think look at the 5 years long, and the county saves the money. And but still, yes, worse than previously. They said state will permanently fund us. So it's still our department's efforts do good job and convince them for the future. But these two is related. One, except because state dissolved previous commitment and pull money back, and so this one issue become two resolutions get approved.
The long and short of it, these two resolutions basically switch funding streams, and we turn out better for it.
Okay. So HE1 is to accept the reduction.
So moved.
So move. Do I have a second?
Second.
Any discussion? All in favor, say aye.
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 Aye. Motion passed. HE2 is getting money back.
So moved.
It's to reinstate.
I'll second.
Any discussion? All in favor, say aye.
Aye.
Aye. And it passes. Thank you, Ralph.
Thank you.
Your show.
Draft and talk about you see this black white is our reason to not a reason since COVID-19 started our positive cases. And here I think it's clearly showed our cases is reduced from the peak in January, but still it's relatively higher than September and October last year, and much higher before from last year March to last year August. And if you look at the national and the world situation, I think yes, we are at a good place. And you heard many countries they increase their cases, and in the state 2 days ago I heard like yes 23 states that increase their cases, and we over the last a month and a half, and we're stable every day around the 20. So it's not too bad. And also I at the 1 or 2 communication daily update you may saw, and we noticed that it's an age shift. Cases shifted to younger population, And that's why another reason we didn't see many deaths in recent. This is. And yeah, for this, it's really at one side it's said vaccine is working, and sure, some young people still end at hospital and tragic outcomes. But overall, because vaccines start at older age to younger age, so we see this reduced. And also, let me talk to you about our COVID-19 operation before I go away for other topics. And most recently, we focus on vaccination. And from January 6th, our first clinic till now, and include the bigger or small clinic, we already run about 40 clinics. And a small clinic could be small, like we go to a homeless shelter and do 20 cases, or as big as like one day we do 1,200 shots. So this vary greatly, and we're still keep doing, and every month, not every week, I think we stably, yes, state provide us 500 to 700 doses, and this is the doses. I don't want to say we can comfortably handle, but at least I feel do our best we can handle. And our staff is enthusiastic, but also very exhausted, and you can see their behavior. Sometimes I call it a risk, but we started set up a policy: never have a Sunday clinic, because something one weekend for 2 days, it's really something I very worried something happens. So now we're trying to do weekend one clinic. If it give us more vaccine, and the weekday we do more. And another we shifted because, as you know, the state put this vaccination at health equity, and we work with different community and cover various population. And in addition to elder population, and we also, as I mentioned, we did the homeless population, and we did the inmates. This ahead of state allow us to do, because in January, it started December, our county jail, we had outbreaks. And when we got the vaccine, we quickly against the state to do it. The reason is really, if we let it go, cost so much money and human power to testing, to get the sample testing them. So we did it very early. And now we already work at the homebound population. And the homebound population, it's very difficult. Honestly, I can tell you. We try to get a homebound list from volunteer fire departments. We try to get a list from faith-based organizations, and we try to get from DSS, and really for this 5-6 weeks, and we got only close to 100. And now I think, yes, Rich is not here. I want to mention he helped review, and we are going to work with National Grid. And the National Grid, they have this, and people in life support devices. So this will be powerful, and let us, yes. And as I said, we got close to 100 homebound, and we already 2.5. No, less than.
Jin Chang, I'm here.
Okay, sorry. And we did more than 30%. It's done. And now, yes, we will keep doing homebound, and after home, not after, In the meantime, we are working on special population is migrant workers. And the first candidate, probably you know, last year we had this Apple facility outbreak, and we will make the first site we will go, and agricultural community is very supportive and working with us. So this is what I want to report to you about COVID-19. You have any questions before
Yeah,
I?
are you still posting on Tuesdays, the clinic for Saturday?
we yes, this is a bigger issue, and we still try to post as early as possible.
Okay,
And used to be Thursday, we have to move to Tuesday because vaccine changed so drastically, and really within less than 2 weeks or even less than 10 days, and Oswego County and the surrounding counties, we have more vaccines than arms give to us. So we push the state and expand, and the state are gradually expanding. So
okay.
this is what we're okay.
Mr. Chairman,
Yes,
the National Grid program that Jin Chang mentioned is that they have a list of customers who are vulnerable for power outages. They may have medical equipment, what have you, in the home. And what they've offered to do is to call all those residences on behalf of the health department with a mutually agreed upon message regarding vaccinating homebound individuals by the health department.
that's very good. That's wonderful news.
Yes, thank you, Rick. This is very helpful.
You set that up, Rich?
No,
I didn't set it up, no.
Legal approval. His
I
legal
reviewed the
approval.
message.
And yes, the connection was from EMO. EMO, they have connected, and Cassie and Renee.
That's good. It's good that people came together to do that.
And I think yes. Look at the time, and I don't want to keep you here. And let's put the other disease activity next time. And I talk about the community collaboration efforts in some public health projects. And yes, despite the COVID-19, and I think our community still very strong in working towards public health. And couple good example I want to share with you. And one is a tobacco cessation program. Tobacco cessation program we already run for 6 years, and this program is for young women, they pregnant or nursing their babies, and if they are willing to quit the smoke, we provide them diapers. And it's really, this is a bigger collaboration, and with the community agencies like Oswego integrated coalition, and OCO private Oswego County OBGYN hospital, and we work together during the whole pandemic season. This program never stopped. And the only thing, if we talk about we stop, is we have to stop. But still, we had once, I think, a virtual meeting, and people working together. And as a program like this is like our Healthy Miles. Healthy Miles is another program encouraging people physically active, and from our department now passed down to OCO, and OCO now, yes, every month we log on. Sometimes, yes, our chairman log on too, and it's really promote physical activities is what we need. And another good example is Oswego Hospital. Oswego Hospital most recently, they got honor and in the statewide, they are the second highest perinatal hepatitis B vaccination, because hepatitis B is very, could be, it's a proceeding to liver cancer, and this stated, not stated, the whole nation, yes, wanted to get the kids vaccinated before they have before mom delivered the baby, and immediately within 24 hours give first shots, and then within 1 month finish 3 shots. So the Oswego Hospital in the whole nation is the second one, and our program work with them very closely. So these are community public health collaboration, and I want to share with you. And this also is a good transition to my next big talk to you, although not many people here, and is county health rankings. County health rankings is a project that started 2010, and this project funded by Robert Wood Johnson Foundation, and this project ranking all counties in the country, their health status, and their ranking, and you can see I put both sides, and one is the ranking health outcomes, and another is ranking health factors. And if you look at it, the color curve, and the one side is 3 curve, and if you look at these 3 curve, you can see our county health outcome is like now stabilized at 50, around the 50s, and throughout the state we have 62 counties. So this is our status, and I leave this, and to also leave it here. And health outcome is the combination of a length of health and the quality, or length of life and the quality of life. So this red line is our overall status. If you flip the page, and another sheet is health factors. Health factors include the red line still is the leading factor I put here. And the 4 another factors is health behavior, clinical care, social economic factor, and the physical environment. And the physical environment, I wanted to say, let's leave it aside, because over this 11, 12 years, their measure changed drastically. So you can see our county's health physical condition is a bigger U. And the first time, 2010, we were like ranked at 20 in the state. This year we're at 15. So it's a bigger U. So for health department, our most focused efforts is really change people's behavior. And I want to mention, and now he's not here, and Mr. Broadwell, when he started his legislator, and I remember one of the questions at the health committee, he asked me, what we have this poor health behavior at the 62 at the bottom. Do you have additional resources to do it? At that time, I honestly answered him, no, we don't have money. So yes, with this initialized, and really, yes, we got the legislature give us some money, and start with this tobacco cessation program, and this money, and then we got another money, change people's behavior, and improve physical activity, and healthy highways program, and these our county. So if you look at and this is the darker line, and our health behavior improved, and from bottom 2010 to 2015, and we raised to 2016. Probably we were at the 44, and then we go down a bit. It's normal, up down, and but the last year was terrible, was 61, and I think, and this year we go back to 57. So this is up down, and we're still working on it, and I hope yes we can stabilize it. And as a fact, the clinical care our county is always good, and I every time I mention we needed to realize state population to physician rates is like one physician to 1,400 population. But in our county, because our Lulu nature, we're short of physicians, and our comparison is one physician to 2,500 population. So it's really our doctor doing a great job in the community, and our mammogram cancer prevention rate is higher than state average. Our flu vaccine immunization rate is higher than average, and our diabetes control is higher than state average. So they're doing a great job. Social economics, yes, health is not just the doctors, public health, it's education, housing, employment. So we need to work together. So this is my presentation I prepared. Any questions, comments?
Big crowd. No, I don't think so.
Okay. Thank you.
Oh, okay. So I guess we need to approve the minutes from last month because we went into executive. I don't know, is Morris still on? I don't think we're gonna quorum.
Jim, if you don't have a quorum, it'll have to be put over to next month.
All right, we'll put it over to the next one.
You can't even adjourn the meeting.
Hey, Rich, do I have to put adjournment off for a month?
If you like a quorum, the only thing you can do is adjourn.
Okay. Make the motion to adjourn.
I second it. All in favor?
All right.
Thank you.